5 warning signs of respiratory issues in young children. Have you ever wondered if your child's cough or heavy breathing might be more than just a cold? Breathing problems in young children can affect their growth, energy, and overall health, and catching them early is key to keeping your child active and thriving. Between infancy and early childhood, a child's lungs are still developing, making them vulnerable to issues like asthma, infections, or even rare conditions. Some kids breeze through their days with clear breathing and boundless energy, while others show subtle signs that something is not right. The difference often lies in 5 key warning signs, clear signals that your child's respiratory health may need attention. In this article, we are going to explore 5 warning signs of respiratory issues in young children, backed by pulmonary research from trusted sources like the American Academy of Pediatrics and the World Health Organization. These are not just random symptoms. They are patterns doctors and scientists have identified in kids with breathing problems. By the end, you will know exactly what to look for in your child, why these signs matter, and what you can do to protect their lung health. Stay with us until the end, because you might be overlooking small clues that could have a big impact on your child's future. Once you recognize these signs, you will have a clear plan to help your child breathe easier and stay healthy. Let's get started. Sign 1. Frequent coughing. The first warning sign that your child might have a respiratory issue is frequent or persistent coughing, especially if it worsens at night or lasts more than a few weeks. According to a 2023 guideline from the American Academy of Pediatrics, chronic coughing is a common symptom of asthma, a condition where the airways become inflamed and narrow. A cough that lingers beyond a typical cold, disrupts sleep, or occurs after activity could also point to other issues like allergies, bronchitis, or even early signs of a more serious condition. Coughing is your child's body trying to clear irritants from the airways, but when it happens too often, it can signal that the lungs are struggling. Imagine 2 preschoolers, Emma and Noah, both 5 years old. Noah has a cough now and then, usually with a cold that clears up in a week. His lungs seem fine, and he sleeps soundly. Emma, however, coughs almost every night, especially after running around or when she is lying down. Her parents think it is just allergies, but the coughing keeps her awake and makes her tired during the day. What they do not realize is that Emma's frequent cough could be a sign of asthma or another airway issue. Left unchecked, chronic coughing can lead to fatigue, poor growth, and even worsening lung function. The good news is that you can take action if your child has a persistent cough. Start by tracking when the cough happens, how long it lasts, and what triggers it, like exercise or cold air. Share this information with your pediatrician, who may recommend tests like a chest X-ray or spirometry to measure lung function. Keep your home free from smoke and dust, as these can irritate the airways. If your child has allergies, a doctor might suggest an antihistamine or inhaler. Ask yourself, does your child cough often, especially at night or after play, or is their breathing mostly clear? If coughing is rare, that is a great sign. If it is frequent, do not dismiss it. Seeing a doctor now can help your child breathe easier and stay healthy. If you are finding this valuable, please comment number 1 below to let me know you are here. And if you have not subscribed yet, I recommend subscribing and turning on notifications so you do not miss any updates. Now, let's move on to the next sign. Sign 2. Wheezing sounds. The second warning sign of respiratory issues is wheezing, a high-pitched whistling sound when your child breathes, especially during exhalation. The Centers for Disease Control and Prevention notes that wheezing often indicates narrowed or inflamed airways, commonly caused by asthma, respiratory syncytial virus, or other infections like bronchiolitis. Wheezing happens when air struggles to move through tight airways, and it can be a sign that your child's lungs are not working as well as they should. In young children, whose airways are small, even mild inflammation can cause noticeable wheezing. Consider 2 toddlers, Liam and Ava, both 3 years old. Ava breathes quietly, even when she is playing or sleeping. Her lungs sound clear, and she rarely has breathing problems. Liam, however, started making a whistling sound after a recent cold. His parents hear it when he breathes out, especially when he is active or at night. They think it will go away on its own, but Liam's wheezing could be a sign of asthma or a lingering infection. If ignored, wheezing can lead to more severe breathing difficulties or frequent hospital visits. The good news is that wheezing can be managed with the right care. If you hear your child wheezing, note when it happens and whether it comes with other symptoms like coughing or fatigue. Contact your pediatrician, who may suggest a lung function test or a trial of an inhaler to open the airways. Avoid triggers like cigarette smoke, pet dander, or strong perfumes, which can worsen wheezing. A humidifier in your child's room can help keep airways moist, especially during dry seasons. Listen to your child's breathing. Is it quiet and smooth, or do you hear a whistling sound? If their breathing is clear, that is a fantastic sign. If you hear wheezing, do not wait. Getting help now can keep your child's lungs healthy and strong. If you are still with me and finding these insights helpful, please comment number 2 below to let me know you are here. Your support helps us keep creating content to inform and inspire you. Let's move on to the third sign. Sign 3. Shortness of breath during play. The third warning sign that your child may have a respiratory issue is shortness of breath during play, where they struggle to breathe or get winded more easily than other kids. A 2022 study in the journal Pediatrics highlights that children with respiratory problems often cannot keep up with physical activities due to limited lung capacity or airway obstruction. This can show up as panting, stopping to catch their breath, or avoiding active play because it feels too hard. Shortness of breath during play is not just about being out of shape. It can signal conditions like asthma or even heart-related issues affecting the lungs. Picture 2 first graders, Sophia and Ethan, both 7 years old. Ethan loves running around at recess, chasing friends without needing to stop for air. His lungs handle the activity with ease. Sophia, however, gets out of breath quickly when she plays soccer. She stops often, holds her chest, and sometimes says she feels like she cannot breathe. Her parents think she is just not athletic, but Sophia's shortness of breath could be a sign of exercise-induced asthma or another lung issue. If untreated, it can limit her activity and affect her confidence and growth. The best part is that you can help your child breathe easier during play. If they seem to struggle, watch how they breathe during activities and note if they avoid running or playing hard. Share these observations with your pediatrician, who may recommend a stress test to check lung function during exercise. Encourage gentle activities like walking or swimming to build stamina, and ensure your child uses any prescribed inhalers before play if they have asthma. Keep them away from polluted air, like near busy roads, which can make breathing harder. Ask yourself, does your child play actively without breathing problems, or do they get winded quickly? If they keep up with ease, that is a great sign. If not, do not assume it is normal. A doctor's visit can help your child stay active and healthy. If you are finding this valuable, please comment number 3 below to let me know you are here. And if you have not subscribed yet, I recommend subscribing and turning on notifications so you do not miss any updates. Now, let's move on to the fourth sign. Sign 4. Frequent chest colds. The fourth warning sign of respiratory issues is frequent chest colds or respiratory infections, where your child seems to catch colds that settle in their chest more often than their peers. The World Health Organization states that recurrent chest infections can indicate a weakened respiratory system, possibly due to asthma, allergies, or an immune system issue. These infections often come with symptoms like coughing, congestion, or fever, and they can take longer to clear up, putting extra strain on your child's lungs. Think about 2 preschoolers, Noah and Mia, both 4 years old. Mia gets the occasional cold, but it rarely affects her chest, and she bounces back quickly. Her lungs seem strong, and she stays healthy most of the year. Noah, however, gets chest colds several times a year. Each one comes with a deep cough and wheezing, and he takes weeks to recover. His parents think he is just prone to colds, but Noah's frequent infections could be a sign of an underlying issue like asthma or a condition affecting his airways. Repeated infections can weaken the lungs and make future illnesses more severe. The good news is that you can support your child's lung health to reduce chest colds. Keep track of how often your child gets sick and whether the colds affect their chest. Share this with your pediatrician, who may suggest tests to check for allergies, asthma, or immune deficiencies. Ensure your child gets all recommended vaccinations, like the flu shot and pneumococcal vaccine, to protect against respiratory infections. Teach them to wash their hands often and avoid sharing drinks to cut down on germs. Check in. Does your child get chest colds more than a few times a year, or are they mostly healthy? If infections are rare, that is a strong sign. If they are frequent, do not ignore it. A doctor can help strengthen your child's lungs and keep colds at bay. If you are still here and finding these insights valuable, please comment number 4 below to let me know you are with me. Your support helps us keep creating content to inform and inspire you. Now, let's move on to the final sign. Sign 5. Blue lips or fingernails. The fifth and final warning sign of respiratory issues is blue lips or fingernails, a condition called cyanosis that signals dangerously low oxygen levels in the blood. A 2021 study in the Journal of Pediatrics emphasizes that cyanosis is a medical emergency requiring immediate attention. It can happen during a severe coughing fit, after intense activity, or even at rest, and it means your child's lungs are not delivering enough oxygen to their body. Cyanosis can be caused by severe asthma attacks, pneumonia, or other critical conditions. Consider two toddlers, Olivia and Lucas, both 2 years old. Lucas has clear, pink lips and nails, even when he is playing hard or sick with a cold. His lungs supply oxygen efficiently. Olivia, however, had an episode where her lips turned blue during a bad coughing fit. Her parents rushed her to the emergency room, where doctors found a severe respiratory infection. Olivia's cyanosis was a warning that her body was in distress, and quick action saved her. Blue lips or nails are never normal and should always prompt urgent care. The good news is that you can act fast if you see this sign. If your child's lips, nails, or skin turn blue, call 911 or go to the nearest emergency room immediately. While waiting for help, keep your child calm and upright to ease breathing. After the emergency, follow up with a pediatrician to find the cause, which could range from a one-time infection to a chronic condition. Watch your child closely. Are their lips and nails always pink, or have you ever noticed a bluish tint? If they look healthy, that is a fantastic sign. If you see any blue, do not hesitate. Acting quickly can protect your child's health and life. If you are still here and finding these insights valuable, please comment number 5 below to let me know you are with me. Your support helps us keep creating content to inform and inspire you. Now, let's wrap this up. Additional signs to watch for. Beyond these 5 signs, other symptoms can also indicate respiratory distress in young children. Rapid breathing, where your child takes many breaths per minute even at rest, can suggest they are working hard to get oxygen. Grunting noises during exhalation or visible retractions, where the skin pulls in around the ribs or neck while breathing, are also serious signs. Nasal flaring, where the nostrils widen with each breath, or head bobbing in infants can further indicate breathing difficulties. If you notice any of these, seek medical help right away, as they point to significant respiratory strain. How to support your child's respiratory health. While spotting warning signs is critical, you can also take proactive steps to keep your child's lungs healthy. Vaccinations. Make sure your child is up to date on vaccines, including the flu shot and pneumococcal vaccine, to protect against respiratory infections, CDC vaccines. A clean environment. Keep your home free from cigarette smoke, dust, and mold. Use an air purifier if your child has allergies or lives in a polluted area. A hygiene. Teach your child to wash their hands regularly and avoid touching their face to reduce the spread of germs that cause respiratory infections. A healthy lifestyle. Encourage a balanced diet rich in fruits and vegetables, regular physical activity, and plenty of sleep to boost immunity and lung health. Regular checkups. Schedule annual well-child visits with your pediatrician to monitor your child's growth and catch any early signs of respiratory issues. When to seek help. Most respiratory issues in children can be managed with early intervention, but some signs require immediate action. If your child shows blue lips or fingernails, has trouble breathing, or seems unusually lethargic, call 911 or go to the emergency room. For less urgent signs like frequent coughing or wheezing, contact your pediatrician within a day or 2 to schedule an evaluation. Keep a log of symptoms, including when they occur and what makes them worse, to help your doctor make an accurate diagnosis. Final thoughts. Now that you know these 5 warning signs, take a moment to think about your child's breathing. Do they cough often, wheeze, struggle during play, get frequent chest colds, or show any signs of blue lips or nails? Or are their lungs clear and strong, letting them play and grow without trouble? The good news is that you have the power to protect your child's respiratory health. Your actions today, whether it is scheduling a doctor's visit, reducing exposure to smoke, or ensuring vaccinations, can make a huge difference in their well-being. Respiratory issues do not have to hold your child back. By staying alert to these signs and acting quickly, you can help your child breathe easier, stay active, and grow strong. If you have noticed any of these warning signs, do not wait for them to get worse. Reach out to your pediatrician, ask questions, and take steps to support your child's lungs. Your care today will help them thrive tomorrow. Thank you for sticking with me through this journey. If you found this helpful, Please leave a comment below with your thoughts, and do not forget to subscribe and turn on notifications for more tips to keep your child healthy. Here is to clear breathing and a happy, active future for your child.